Imagine a future where chronic diseases are a thing of the past and the health and well-being of America's children and families are the top priority. The second MAHA report, released by the White House, has sparked a heated debate about the best approach to achieving this vision. But here's where it gets controversial. The report's focus on voluntary commitments from companies and a softer stance on pesticides has raised eyebrows among health experts. The Make America Healthy Again Commission's strategy report, issued on Tuesday, outlines a roadmap to make our children healthy again, but critics argue that it lacks concrete policy and regulation. Instead, the report calls for studies of previously approved medical treatments and asks companies to make voluntary commitments to improve nutrition, increase exercise, and review vaccines and prescription drugs. According to Health and Human Services, HHS Secretary Robert F. Kennedy, Jr., this strategy represents the most sweeping reform agenda in modern history, realigning our food and health systems, driving education, and unleashing science to protect America's children and families. The MAHA strategy includes several key components, such as restructuring HHS to include the Trump administration's Administration for a Healthy America, developing a vaccine framework to ensure the best childhood vaccine schedule and addressing vaccine injuries. However, the report's lack of specifics on reforming the approval process for chemicals and pesticides has left many wondering if the administration is taking a strong enough stance on these issues. And this is the part most people miss. The report's call for updating CDC guidance on water fluoridation and forever chemicals in water could have significant implications for public health. The creation of a mental health diagnosis and prescription working group to evaluate prescription patterns for common psychiatric medications is also a crucial step towards improving mental health outcomes. As we delve into the details of the report, it becomes clear that the administration is taking a multifaceted approach to addressing the complex issues surrounding chronic disease. But will it be enough? The controversy surrounding the report's approach to vaccines and pesticides is sure to continue, with some arguing that the administration is not doing enough to regulate these industries. Others may argue that the report's focus on voluntary commitments and education is a step in the right direction. As we consider the implications of the MAHA report, we must ask ourselves, what is the best way to protect the health and well-being of America's children and families? Is the administration's approach too soft, or is it a necessary step towards creating a healthier future? We want to hear from you. Do you think the MAHA report goes far enough in addressing the issues surrounding chronic disease, or are there other approaches that should be considered? Share your thoughts in the comments below. In other news, the Trump administration is planning to ramp up oversight and enforcement of direct-to-consumer prescription drug advertising, but will stop short of an outright ban. The Center for Disease Control and Prevention, CDC, has also released a report raising awareness about the deadly kissing bug disease, which can cause severe fatigue, heart problems, and digestive issues. As we navigate the complex landscape of healthcare policy, it's essential to stay informed about the latest developments and their potential impact on our lives. The American Academy of Family Physicians, AAFP, is recommending that adults 18 and older, children, and pregnant women receive COVID-19 vaccines, contrary to the federal government's recently narrowed recommendations for the shots. History has shown us that vaccines have eradicated diseases that were once disabling and deadly, and it's crucial that we continue to prioritize vaccination efforts. Around the nation, local and state headlines are highlighting the importance of healthcare policy, from Louisiana's lack of monitoring of public funds given to anti-abortion pregnancy centers to Texas's expected executive order setting age requirements for THC products. As we move forward, it's essential to consider the potential implications of these policies on our healthcare system and the lives of Americans. What do you think about the MAHA report and its approach to addressing chronic disease? Do you think the administration is taking a strong enough stance on vaccines and pesticides? Or are there other issues that should be prioritized? Share your thoughts and let's start a conversation.